Tsuut'ina Nation Stitch. Hello and welcome to the G4 Talks Health podcast. My name is Dalton Dodgenhorse. In this episode, we interview Lacy Runner, Health Director for the Tsuut'ina Nation at the Tsuut'ina Nation Health Center. Follow us on Facebook, Instagram, TikTok, and YouTube. Or go to our website, G4 Health, for more G4 Talks Health podcasts. Describe your journey working in health and what brought you to become a health director in the Tsuut'ina community.
So, I never originally thought I'd be working in the field of health. I always wanted to work in the field of mental health after finishing my bachelor's degree within criminal justice and my master's degree in counseling. But how I really got to this field right now is a personal situation. Losing a close cousin due to suicide, it really opened up that view of how we are still impacted from historical and intergenerational trauma, and how a lot of these impacts continue to put our people in a crisis and to experience a lot of challenges within the school system, the healthcare system, child welfare system and criminal justice system. So when this opportunity opened for a director of health and wellness services, it was definitely becoming its own portfolio within the Tsuut'ina community because both programs were expanding quite quickly, which from my understanding, it became a little too much from the previous supervisor that was overseeing a lot of social development portfolios. And it was a really great initiative because it really brought the two programs together when originally they were not working together at all. They were working in silos. And as we know, mental health impacts overall health, vice versa. So when the opportunity came up, I was encouraged to apply, not thinking I would get it. There were some challenges along the way, but, I ended up where I needed to be as creator thought I would be. And I'm very thankful for this role because it really opened up a lot of opportunities to work with such a great team, to do a lot more and to move towards a different mandate of, rather than that crisis mentality, we are moving towards a direction of preventative and proactive measures to really get to the root causes of it, but to really focus on our children and youth. So becoming a health director, again, wasn't in my journey or my career goals, but like I said, I am where I'm needed to be in this moment, and I'm very thankful, and this job is forever a new experience every day. There's a new challenge every week, which I really enjoy because I thrive on that work ethic that it needs to be exciting for me to stay, because I think right now this is probably the longest position I've stayed in within my career. So I'm very grateful to be in this line of work and to be helping my people. Thank you.
Yeah. And then what are your goals and aspirations for the health of your community?
The goal I have within the health and wellness services for the Tsuut'ina community and the people is to build a healthy community. And I know within my other line of work, I'm a trainer and facilitator for the Crisis and Trauma Resource Institute. And the great thing about that role is I get to visit a lot of other Indigenous communities across Canada, right from the East Coast to the West Coast, right up to the Northwest Territories. And it's really great to connect with them and learn from them, like, what are your challenges? What are your aspirations? And I think our common goal is to build that healthy community. And to build that healthy community, it really starts by focusing a lot of our resources and supports on the children and youth. Because again, it goes back to that preventative and proactive measure. It's getting to the root causes of why we're experiencing so much challenges. And it's the trauma. And I know within Indigenous peoples, we're experts at suppressing our emotions and our thoughts. So my goal within this last couple of years since coming back to the nation within the field of mental health and health is to really start talking about the trauma. Because we need to talk about the trauma. We need to start being uncomfortable, to unlearn a lot of behavior, to learn new behavior, to have our people moving towards that healthy direction, to have a healthy community. Because our children and youth, I would think at this point, probably make up 50% of our population. And that's where we really need to focus on, from the social determinants of health. Not just health and mental health, but the social determinants of health from an Indigenous approach. Because when we have this strategy in place, we're going back to the old ways of how the community raises a child. And that's the purpose of the strategy I'm working on, to bring all programs together so that we can support one another in some of our shortfall when it comes to funding, resources, so that we can work together so that we're building that healthy community together and not in a silo approach that's from a colonial and assimilation mentality.
If somebody in the community wanted to reach you, where could they contact you? If somebody wanted to even like go into mental health or go into health, where could they go, or like what resources in Tsuut'ina do they have?
So I know that's one of my main goals too while being in this role, is to get more of our people, more of the post-secondary students, or even the high school students, or anyone, because it's never too late to go back to school. Learning is always a lifelong thing. You know, we're always learning every day. Like my grandpa Gerald always says, we learn something new every day. And I highly encourage our people to go into the field of mental health and health, because there's always careers within this field. And it's so rewarding to know that you're helping people within their healing or recovery journey. So in order to do this, what we're trying to establish is a partnership with the education portfolio to even offer incentives for anyone, even if it's job shadowing. They're more than welcome to come talk to myself, Joel Fisher, or Richard LeBlanc, who are the associate directors of the program. And what we've agreed upon is that we want to encourage our people to be in this line of work. We're even willing to provide tutoring, because we know within this field it is quite hard, especially to get into nursing. So we're willing to dedicate our time to even show like this is what it entails working in the field of health or mental health, because when we can have more of our own people in this line of work, we're moving towards reconciliation. You know, part of the TRC calls to action is to have more of our people in this line of work, because they understand it. They understand the trauma, the challenges from a lived approach. But when you get that education, it's hitting two birds with one stone. You're walking in two different worlds, but to help our own people towards reconciliation, but to also build those healthy communities. So if anyone wanted to get in contact with me, they can call the health center, 403-251-7575. They can even contact me through my email, which is lacy.runner@tsuut'ina.com. My door is always open. I'm always willing to listen to the people, to the community, on what they want to see within these programs, because the people know best. We are not here to tell the people what they need. We want to hear from the people what they want and what they need, because we...
So yes, Gus, if there's anything else you wanted to add?
Always remember the power of voice and choice. You know, when you can do that and enter the field of education, Canada's biggest threat is an educated Indigenous person. And that's what moves us towards reconciliation, when we can work together with our allies to build these healthy communities, and for other organizations to operate from a trauma-informed approach, because we really need to move towards a viewpoint of compassion and authenticity, and allowing the people to know that their unique identity is something to be proud of. So I always encourage a lot of our people to get into the field of mental health and health, because that's what's really going to start building these healthy communities.
Sweet. Thank you. Zias Gus, thank you for listening to today's episode with Health Director Lacy Runner of the Tsuut'ina Nation. You can visit our website, www.g4health.org, for more information and updates on the podcast. You can follow us on Facebook, Instagram, and TikTok at G4Health. Nani estane. You can go to our website G4Health for more information and updates on new podcasts.